And so we want to take a moment here just to talk about what is health and well-being. And there's some differences here. We, in our advisory group, when we developed this curriculum, we heard from a lot of folks that, obviously Western and tribal communities define health very differently. And in the tribal world, there's all sorts of definitions of health that are different within the tribal world. And so, for example, one of the ways that the Swinomish tribe defines its health is through what they call their indigenous health indicators. And their metrics for what is considered a healthy community include self-determination, cultural use, natural resource security, resilience, education, and community connection. Those are values that their community knows is integral to their overall health. The Alaska Native Tribal Health Consortium has a different take, more of a public health view of health, where it talks about providing whole person health services and medical care, preventative wellness programs, rural community infrastructure development. And so that sounds a little bit more like a public health infrastructure. And so it runs the gamut. I want to tell you a little bit about how we define health within the Tribal Climate Health Project and how we're going to organize the content that we present to you. So we define health more broadly than the absence of medical disease, which is oftentimes what you hear in some of the Western publications or literature. So we have a section for human health. So that would include physical and psychological health. But we also have a section for spiritual and cultural health and socioeconomic health. And so those are the sort of sub-elements of our social and health environment. But we also want to tap into the idea that health is dependent upon elements of both the natural and built environment. So we know that tribes consider their health very interconnected and dependent upon social and ecological systems. And we know that those systems are being disrupted by climate change. And so I just want to share a few frameworks that come out of some of the national literature. This diagram on the left is from the CDC, and it just does a good job of, at a high level, showcasing some of the health impacts of climate change. And as you can see, they're sort of cascading out. So we really like when diagrams show relationships. And so they're talking about some exposures like rising temperatures leading to some things like water and food supply impacts, and those things having health impacts, including basically an increase in human health threats like illness, injury, death, trauma, and we don't want to forget other mental and psychosocial consequences. And so in this training, when we talk about human health, we are going to include mental health and well-being within that framework. And so the United States Global Change Research Project is really clear about its key findings with its climate and health assessment. It says there's going to be increased exposure to extreme events and coastal flooding that will affect health. Not only that, is there going to be direct impacts, but the disruptions of those events to essential infrastructure can limit access to healthcare and emergency response services. This is a fun diagram I just came across this past week that comes out of the Medical Society Consortium. So I'm trying to present, because I know a lot of you are environmental or sustainability professionals, trying to present some things that are coming out of the health world, because there is a lot of information emerging. People are getting serious. This just does a good job of trying to diagram by region where certain health impacts are expected. I like it. Feel free to use it in your work. So it's ranging from extreme events to water-related infections and wildfire. It's based again off the United States Global Change Research Project information. I see some gaps here actually that I would change, but I do think it's a nicely laid out diagram and does a good job. So you can actually just look at your own region and look at the legend there and see, at a high level, you get a snapshot of the types of things that might be coming your way that you will want to prepare for. Just a couple more frameworks. These are coming from the National Climate Assessment as well. And so what I like about the diagram on the left is that it does a good job outlining some of the mental health impacts of climate change, including stress, substance abuse, post-traumatic stress disorder, and community health. So on a community scale, what changes are we seeing? Anything from violence and crime to decreased community cohesion. Those are all, for me, very, very integral in overall community health. do want to point out a lot of times it's really important to consider vulnerable populations when we talk about health, because all that means is that there are some populations that are going to be more sensitive to some of the climate impacts than others. And we hear in the literature all the time, sometimes they lump indigenous communities all together as being vulnerable. But within tribal communities, you'll want to know who are your most vulnerable populations and who you might need to provide extra protections for. And so older adults, maybe you would refer to them as elders, children, and folks that are lower income, those are often cited as folks that are more vulnerable, and also people that have pre-existing physical or mental health conditions.